Welcome to the Facebook Live session. On the occasion of Lung Cancer Awareness Month, today our topic for discussion is all about lung cancer. And for our discussion, we have with us Dr. Ashwin M Shah, Senior Consultant Radiation Oncologist at Apollo Cancer Center, Jubilee, Hyderabad. Dr. Ashwin M Shah has been working as an oncologist for over 30 years. He received his formal radiation oncology training at MNG Institute of Oncology, Hyderabad. He has vast experience in dealing with various types of cancers. He has done numerous brachytherapy procedures for cancer of cervix, head and neck, sarcomas, and esophagus. His special interests lie in head and neck and gynecological malignancies. He is well versed with all the latest type of radiotherapy treatment modalities like IMRT, rapid art tomotherapy, image guided radiotherapy, and stereotactic radiation. So, welcome, doctor, to our Facebook Live session.
Namaste.
So, starting with our questions. So, doctor, could you please brief our audience what is lung cancer?
Like to tell you very frankly, except for the hair and the nails, any part of the body can develop cancer. So one among these cancers is a lung cancer, which is the foremost and the important as we consider the world population. It ranks one as such, and the lung cancer is a cancer which occurs or starts in the lung. It can be right or lung, either side it can affect.
Doctor, usually what are the signs and symptoms of lung cancer?
The most common thing is the cough, which doesn't subside for a few weeks. I would say 3 weeks. Beyond 3 weeks, you need to get yourself evaluated. Second thing is when you're coughing out the blood. And third thing, like what we say is that if the lung is advanced, then it may present as chest pain. And most of the time we see that we find the disease already spread to other areas like bone, brain or liver. So they have the symptoms accordingly. This is a stage 4 disease of lung cancer. So these are the 4 common signs of the symptoms of the cancer, lung cancer.
So, doctor, generally, are there any risk factors associated with lung cancer?
Yeah, basically the habits are the most killing thing in the lung cancer. And the most and foremost is the smoking. Smoking is proved like it is a cause for the lung cancer. Apart from this, the habits of food habits, then the less amount of exercise to the body, and third thing is even the passive smoking can lead to lung cancer.
So, doctor, is it true that smoking e-cigarettes and flavored chargeable cigarettes does not affect our lungs or cause any lung cancer?
No, people feel that the e-cigarette just has a nicotine, but nicotine per se is a carcinogen. So even e-smoking is also is at risk of developing lung cancer. Same thing with the flavored type of smokes, which people think that it is a non-cancerous, but definitely it has ingredients which are carcinogens, can lead to cancer of the lung.
So, doctor, usually how do a person know if he or she have lung cancer?
Like most of the time, incidental finding, if suppose it is confined to the lung, just going and getting an X-ray done for some other reason and then it comes out, maybe that is in the early stage. But most of the time in our population, we see stage 3 and stage 4 cancers. Stage 3, I mean to say like it's a local extensive disease in the lungs or in the chest, which can produce with the pain or breathlessness. And stage 4 cancer can be, the symptoms are bone pains, liver is affected, brain is affected, having a headache, vomitings because of the brain involvement because of the carcinoma of the lung cancer. And third thing is the fatigueness which the patient develop or complains of. Could be the reason that patient is affected with the lung cancer.
So, doctor, usually how is lung cancer diagnosed?
Lung cancer, what happens, the basic investigation for lung cancer we do first thing is the chest X-ray. Subsequent to this, if required, then we'll go for the CT scan of the chest. And that's not enough. Unless we do the biopsy, that is taking a piece out of the lesion or the disease in the lung and examining under the microscope by the pathologist. So only way of diagnosing the lung cancer is by the biopsy. The second thing is you can do the cytology if the patient is bringing out the sputum. So you can just screen the sputum or do the cytology of the sputum. It may reveal malignancy or malignant cells in the sputum. So this is the way we can come to the conclusion that the person has affected with the carcinoma of the lung.
So, doctor, are there any staging in lung cancer?
Yeah, after the diagnosis of the lung cancer or any cancer as such person is diagnosed, we do the staging workup to see that what stage the patient is in. Like any cancer, we have 4 stages. So for this, we do the different tests like we do radiological examination of the chest, abdomen, and nowadays we are doing the PET CT. The one go we know the spread of the disease or the stage of the disease as such.
So, doctor, usually what are the treatment options that are available for lung cancer?
So basic depending on the pathology of the lung, we have different types of lung pathology of the non-small cell, small cell, and the two types are there. But basically, what we have it is incidental finding, early stage surgery is the treatment of choice. Subsequent to this, when the patient has the stage 3 or 4, in that case, the primary treatment remains the chemotherapy, that is giving the drugs to control the disease or to stop the disease, and then sometimes we may have to go for the radiation, especially when we give radiation, it's a local disease is there, we can as well avoid surgery where the patient is not medically fit for the surgery. Other thing is when the patient has the metastatic disease, that the disease has spread to the bones, to the brain, then we again use radiation to control the disease or the decrease the symptoms because of this metastasis.
So, doctor, what are the types of radiation therapies that are available for lung cancer?
Basically, external radiation is either it can be a curative dose where we use the very high dose of radiation to control the disease when it is localized, and the size is also matters. Suppose it is less than 3 millimeters, then we can go for stereotactic body radiotherapy to intending towards the cure of the disease. And second thing is when we give as an adjuvant after the surgery, there are few indications where the patient may require radiation, or sometimes we give along with the chemotherapy radiation, that is concurrent chemotherapy and radiation. And apart from this, when we treat this lung cancer, we have other way of dealing. Sometimes we do endobronchial, that is a brachytherapy, which very few centers are doing, but that is also a modality where the disease in the bronchus or in the airway, we put the bougie-like thing which gives a local radiation into the bronchioles.
So, doctor, what is the role of radiation therapy in lung cancer?
I was just mentioning about the radiation in brief, like this early stage disease, stage 1 disease, it can be a curative intent as such. But most of the time it is adjuvant or neoadjuvant when we go for the radiation, especially in squamous cell carcinoma, where we need to give radiation along with the chemotherapy. And sometimes it can be just palliation where the patient is just coughing out blood and you want to stop the bleeding. Then we give palliative radiotherapy to control the bleeding from the lung lesion.
So, usually, are there any advantages of radiation therapy in lung cancer?
Like I was just mentioning about where the patient is diagnosed in the early stage and is not fit for the surgery. In that case, we definitely radiation has the role as a radical treatment. We go for stereotactic body radiotherapy intending towards the curing the lung cancer. And in some of the cases, we have to give radiation along with the chemotherapy to have the better results or outcome.
So, coming towards our audience question, so doctor, how does lung cancer affect someone emotionally?
Like not only lung cancer, as such a cancer patient once diagnosed, so patient gets upset, like basically go into depression. It's not that cancer affects the person who is affected with, but shatters the whole family as such. But taking the consideration of the development and what we see in the field of medicine for treating cancer, we are having line of treatment. We start with the chemotherapy. We have first line, second line, third line. Then we have targeted therapies or immunotherapy to take care of the disease so that we can prolong and give little comfortable life to the patient.
So doctor, usually what type of lung cancer spreads quickly?
One of the deadliest cancer of the lung is the small cell lung cancer, which spreads like we call it, it's the most aggressive cancer in the lung cancer. Small cell lung cancer, most of the time it presents in advanced stage with the metastatic, and though it is treatable, but this particular small cell, it comes back after the treatment once the disease is controlled. So follow-up is very important, and this is supposed to be the most deadliest cancer in the lung as far as the pathology is concerned.
So, doctor, is it true that lung cancer progress very fast?
It depends, like there are slow growing cancers, there are fast growing cancers anywhere in the body as such, in different parts of the we have. It depends on the doubling time of the cell. What happens, the normal cell becomes malignant of a cancer cell and it starts the doubling, one becoming two, two becoming four, like this. It keeps multiplying. So where the time period is short, where the size of 1 centimeter becomes 2 centimeter can happen in few weeks, can happen in few months also. So depending on the pathology, it can be fast growing cancer and sometimes it can be slow growing.
So, usually, what are the signs that lung cancer is progressing?
Basically, I was just mentioning in the early talk that cough is the most common cause where the people neglect, like because in India, what happens, no, this is mistaken for the tuberculosis of the lung. So many a times the periphery doctors know they start with the AKT, that's for the treatment for tuberculosis, and it's like, okay, you can give a try, but wait for 3 to 4 weeks, like not beyond that. You need to get evaluation of the lung so that this chronic cough can be due to because of the cancer in the lung. The second thing, what the patient that complains of is the blood in the sputum. When he coughs out blood, that could be the reason that patient is maybe having lung cancer. Apart from that, local pain of the chest, and the last but not least is the breathlessness because of the advanced local disease of the carcinoma of the lung.
So, doctor, can lung cancer be treated with radiation therapy or is it always required for a surgical treatment?
No, what I was telling, like in early stage, it is either surgery, because we prefer surgery because in the early stage it's better to get rid of the disease. But if the patient is not fit medically, then we go for the radical radiation, which was mentioning about the stereotactic body radiotherapy. Then second thing, what we see is that when we need combination of chemotherapy and radiation therapy, most of the time it is the squamous cell carcinoma of the lung. And the third thing is small cell, where we have chemotherapy for treating the disease as such.
So, doctor, usually how long that a patient can survive with lung cancer?
They say that 15% of the 5 years survival, the general is there, 5 years, irrespective of the stage. In general, I am telling. So it depends on the type of pathology the person is affected with, and also the initial stage of the disease. So if it is a stage 4 disease, we hardly see 5% of the people surviving for 5 years. And if you say stage 1, then the percentage is quite high where they survive for longer time.
So, is lung cancer treatable completely?
Yeah, if it is initial stage 1, it is, we can say that we can cure the disease, we can treat the disease completely.
So, doctor, are there any chances of recurrence of lung cancer?
Most of the cancer, like any cancer as such, we treat whether it is a stage 1 or 2 or 3 or 4, irrespective of this. Once the treatment is through, the patient is advised to come for regular follow-up. This is only to see that we can pick up the recurrence at the early stage so that we can again strike or we can treat the disease again. So most of the cancers, like if it is beyond local disease, it has the chance of coming back, and more the disease at the initial stage of the disease, the chance of recurrence is high, and usually the recurrence is very high in first 2 years of the treatment of the cancer.
Can a person live a normal life after a lung surgery?
Absolutely. The patients who is treated of cancer or any cancer or lung cancer can lead a normal life. He can go back to normal activities, or he can go back to his work, what he was working earlier.
So, coming towards our last question, doctor, could you please tell our audience about the facilities provided at Apollo Cancer Center, Jubilee Hills, Hyderabad?
At Apollo Jubilee Hills, Hyderabad, we have 3 different machines which we use for treating, and we have the latest of its kind, the True Beam, which was just installed 6 months back. So we have the facilities right from 3D CRT, the techniques which can offer to the patient depending on the situation. Then IMRT is there, the image guided radiotherapy, rapid arc, and then we have tomotherapy. So it has its own advantage as we go up with the technology.
So, dear viewers, we have come to the end of our session and hope we have covered all aspects If you still have more doubts, you can book an appointment with Dr. Ashwin M Shah and clarify your doubts. Thank you, doctor, for educating our audience in today's session.
Thank you.
Thank you for joining us. Stay tuned for more such educative live sessions. Namaste.